Prosthetic joint infection case discussion. A 45-year-old male with a history of knee replacement presents with knee pain and swelling 10 weeks after dental extraction. He recently had dental work and was not given prophylactic antibiotics. He now presents with signs of infection around the knee joint, with elevated CRP and ESR. Possible VIVA questions. What is the likely source of the infection in this case? The answer is hematogenous spread from dental work. Dental procedures can introduce bacteria into the bloodstream, which can seed the prosthetic joint, causing infection. How would you confirm the diagnosis? The answer is joint aspiration and microbiological cultures of the fluid are necessary to confirm the diagnosis and identify the pathogen. Aspiration provides direct evidence of infection by isolating the pathogen from the joint fluid. What preventive measure could have been taken before dental work? The answer is prophylactic antibiotics prior to dental procedures to reduce the risk of hematogenous spread. Patients with prosthetic joints are at higher risk of infection from bacteremia caused by dental procedures.